This is Ginger Keene. In this session, we're going to do the sinus review of the homework you completed from the first lecture day. Let's go to the first thing that we want to review is, again, the normal conduction. We did this on the first lecture in electrophysiology. Just a reminder, it is very important to understand the normal conduction of the heart before we move forward into the other rhythms or dysrhythmias that you're going to be learning today. The first thing you're going to do is I note the different letters and what they are, so I'm just going to review them with you. In the first part of the conduction system, it comes from the SA node, which is D. So your SA node is the primary pacemaker. It fires at a rate of 60 to 100. That impulse will travel in two different directions. It goes intranodal through E and B with Bachmann's bundle so that it goes to the left atrium. And again, the goal is for both atriums to depolarize at the same time. So that impulse starts at the top of the atrium and it's moving in the direction towards the AV node, which is A. So your AV node, again, your AV node is the gatekeeper to the ventricles. It allows a slight pause to allow the atriums to empty, contract, and empty into the ventricles. So the electrical impulse that at the same time both atriums were depolarized, which causes the contraction of the atriums to empty through the tricuspid and the mitral and the tricuspid valves into the ventricles. Once that has occurred, the AV node will then send down G, your bundles of His, in the septum of the heart, and it'll travel down the right and left bundles. Again, your left bundles have two other bundles, so your anterior and posterior vesicular bundles, because your left ventricle is larger than your right. So it wants to have optimal amount of ways to depolarize both ventricles at the same time. So that impulse will travel down the bundles very quickly and then be delivered to within the Purkinje fibers, deep within the myocardium. It will quickly be sent to all of the myocardial cells within the ventricles to depolarize and telling the cells to contract. And again, the goal is that your ventricles depolarize at the same time so that blood will go from your right ventricle into your pulmonary and your left ventricle out to the aorta and out to the body. The first strip is 6.5. Again, we're going to review each of these types of measurements. We're going to first determine if the rhythm is regular or irregular. So with this one, we have a regular rhythm, and it is a rate of 54. I just want to remind you, if you were to do the quick 6 second, you would count how many R waves between the 6 seconds. From here to here is, from here to all the way to here is 6 seconds, because from here to here is 3 seconds. Okay, so we're going to count, and we are only going to count the R waves. So therefore, we do not count this last complex if we were to do a heart rate. So within that, we have 5 complexes or R waves. So therefore, we are around 50. But because it's a regular rhythm, our more exact rate would be 54. All right, so now we have, let's look at our P waves. We have P waves for every QRS. They are all alike. They're all upright. They all look the same. So we know that they came from the SA node. Because again, when it comes from the SA node, it goes in the direction from a negative to positive, producing a positive deflection, which would be an upright P. So we're going to call that sinus. Your PRI, so because you have a P and an R, so we're going to measure our PRI. From the measurement, we're going to measure our beginning of the P to the beginning of the QRS. Again, you want to measure your beginning of the P to the beginning of the QRS. And you should measure a couple of them. So your PR interval looks like about 4 boxes, 3.5 to 4 boxes. So it'd be 0.14 to 0.16. Your QRS. So your QRS, again, I'm going to measure again where your QRS is. Looks like about 2 boxes there. Some might be a little bit less. This one looks like even a little bit less. Go over just a hair. So it looks like about 1.5. So your QRS is 0.06 to 0.08. Your QT intervals. Your QT intervals, you measure from the beginning of this one doesn't have a Q, so we're going to measure from the beginning of the R to where the T wave meets the isoelectric line. So let's see what we got here. So it looks like not quite 10 boxes, so about 9, so 0.36 to 0.38 maybe. And the other thing that you may or may not have picked up with this rhythm is that there is a U wave. If you haven't noticed it, there's a very low voltage. And again, that's what your U wave is going to look like. It is very low voltage. Oftentimes you may even miss it. So I'm going to erase all this so you can see it. So you do have a U wave. Our interpretation of this rhythm, the heart rate is less than 60, so we are going to call it sinus Brady because it originated in the SA node, so we call it sinus. The heart rate is less than 60, so we're going to call it sinus Brady. And you can note that there is a U wave. What are you going to do about that? Maybe look at the electrolytes. Again, that sometimes patients who have hypokalemia, low potassium, can oftentimes develop a U wave because of that. In strip 6.9, the rhythm, if you look at the underline or the basic rhythm, your R to R's are regular, except for this pause. So you can determine what a rate is from your R's to R's of the regular rhythm. And if you did that, the heart rate would be 58. You also have, we're going to look at the P waves. So you do have P waves. There is a P wave before every QRS. They're all upright. They all look the same. So we're going to call that sinus because that's where they originated from, the SA node. Your PR interval. So you're going to measure from the beginning of the P wave to the beginning of the QRS. Some of them are a little shorter than others. So you might have a range, and this one looks like about 3.5 to 4 boxes. So 0.14 to 0.16. Your QRS interval, let's measure our QRS. So because you have some ST depression, it makes it more difficult. So you kind of have to pull it up to where it would normally be and measure across. I'm going to do a couple of these. So it looks like it's about 2, maybe even 2.5 boxes. So your QRS is 0.08 to 0.10. Your QT interval, this one's a challenging one because your T waves are upside down, so then you have to figure out where did they come back up to. So I'm measuring where it actually almost looks biphasic. So from here to here, it looks like it's almost 12 boxes. So that would be 0.48, I believe. So it's pretty long. So your interpretation of this rhythm would be sinus Brady, because your underlying rhythm is 58, less than 60. You came from the SA notes, we call it sinus, and it has a pause. So when we look at the pause, are we going to say it is a sinus arrest or sinus exit block? And you would determine that when you take your calipers and you do your R to R's and determine the regularity and basically determine where the next one would be and if this one came in on time or not. So it does not come in on time, so therefore it is a sinus arrest. If it did come back on time, then it would be a sinus exit block, but this is classified as a sinus arrest. We also want to note that there is ST depression and T-wave inversions, and that could be significant. So we would want to do a 12-lead EKG on this patient and try to figure out why this patient is bradycardic. He might be having a STEMI. Why do they have a pause? And don't forget, you should measure your pause. So when you measure your pause, you count how many boxes between R to R of the pause. And I counted those, and it comes to about 48 boxes. Again, you can count 5, 10, 15, 20, 25, 30, 35, 40, 45, 46, 47, 48. So you have about 48 boxes. You multiply that by 0.04, and that comes out to a 1.92 second pause. So you would document 1.92 second pause and notify the provider that if this is happening a lot, you probably would want to notify your provider. And plus you have ST depression and T-wave inversion, so there could be ischemia going on. So you would also want to get a 12-lead EKG for that reason as well. In this strip 610, your rhythm is regular, so therefore you would use the small box conversion table, and you would come up with a heart rate of 125. So if you did your R to R's and count how many boxes, it comes to about 12 baby boxes between the R to R. You look in the back of your book at the small box conversion table, you look at 12 and you go across, and it'll give you a heart rate of 125. And again, we are requiring you to convert that heart rate, if it's a regular rhythm, to using the small box conversion table, and you will get that on your test. If you were looking at this rhythm strip and you wanted to do a 6-second strip, then you would count how many complexes or R waves between the 6 seconds. I'm going to draw a line for the 6 seconds so you can see. You're not going to count the first complex, and you're not going to count the last. Remember, you're only counting R waves. You are not including T waves. That is not what the pulse is. It's your QRSs that produce the cardiac output. So you have 12 R waves. You multiply that by 10, so your heart rate is about 120. Now we're going to look at your P waves. So your P waves, you have P waves for every single QRS. They're all upright. They're all look the same, so we know it came from the SA node, so we're going to call them sinus. Now let's measure our PR interval. So I'm going to pick a couple of them. You should measure all your PR and make sure that they're all the same, or at least a few. I'm trying to make them so before. And it looks like about 3.5 boxes, maybe 3 boxes in some of them. Some of them are a little bit shorter. So that would be 0.12 to 0.14. Your QRSs, you're going to measure from the beginning of the QRS to where the S wave comes up. So this is 2 boxes. Some maybe have, this one looks like it's maybe 1.5 boxes, so that would be 0.06, and the other one would be 0.08. Your QT interval, so you measure from the beginning of the QRS to where the T comes back to the isoelectric line. I'm going to give a couple of these. It looks like there is about 7, maybe almost 8, so about 0.28 to 0.30 is your QT, 0.28 to 0.30. And so our interpretation of this rhythm is sinus, because it originated in the SA node, sinus tach, because the heart rate is greater than 100. So what do we do for sinus tach? Patient presents in the ED complaining of right epigastric pain and vomiting. Blood pressure is 156/84 and temp is 101.2. So what would you think the cause would be? If you guess that some hypovolemia or dehydration, and the temperature would be potentially the two causes of this sinus tach. So your treatment would be give them volume, give them some fluids, and give them like Tylenol or ibuprofen to treat the temperature. So that would, remember, sinus tach, treat the cause. In 6.27, this rhythm, the basic rhythm is regular, but it does make it look irregular because of the pause. So you can do a heart rate for the first original. So count how many boxes between R to R's. If you do, you get a heart rate of 72. You're looking at your P waves, and they are sinus. There's a P for every QRS. They're all upright, so we know they came from the SA node. Your PR interval, so we're going to measure from the beginning of the P to the beginning of the QRS. Beginning of the P to the beginning of the QRS. It looks like some of them are a little bit, maybe only 3 boxes. Some of them look like about 3.5 boxes. So with a PR interval, it's about 0.12 to 0.14. Now let's look at our QRS. Your QRS, you're measuring again from the beginning of the QRS to where the T wave or the S wave comes back up to the ST segment or the J point. And it looks like about 2 boxes, maybe 2.5, some of them. So with your QRS, again, you're measuring from the, looks like about 2, so 0.08. Your QT interval, so you're measuring from the beginning of your QRS to where the T comes to the end. Meets, show you over here, so where it measures. And it looks like about 8 to 9 boxes, so 0.36, maybe 0.38. So your interpretation is normal sinus rhythm because the heart rate, underlying heart rate is 72. And it is normal sinus rhythm, and it has a pause. So what kind of pause is it? Is it a sinus arrest or a sinus exit block? Now, if you did your calipers and you did your, I know I'm not going to do it right here, but if you did your calipers, and what would happen is if it did come in on time, these are not good calipers, but it did come in on time. It's almost like it's missing 2 complexes in this, and it would be considered a sinus exit block. So when you have a sinus exit block or any pause, we want to measure the pause. So when you measure the pause, you count how many boxes between this R and this R. And again, you're going to count it. You got 5, 10, 15, 20, 25, 30, 35, 40, 45, 50, 55, 60. It looks like 1, 2, 3. So you have 63 boxes. You multiply that by 0.04, and you have a pause of 2.52 seconds. So 2.52 seconds. Sorry, it's not very neat, but so that would be your pause, and you would report that. And again, you always want to check your patient, make sure that they're okay, and see if they're having lots of pauses or if they're having frequent pauses. That would be something that would be significant. In 6.36, this rhythm is considered regular. The heart rate is actually 41. If you were to do a 6-second strip, you only count between the 6 second, whoops, that was a little bit off, 6 seconds. So you have 4 complexes, so your heart rate's about 40. Your P waves, you do have P waves. They are all upright. They all look the same. That means that it came from the SA node. Let's measure your PR intervals. So the beginning of the P to the beginning of the QRS. You measure a couple of them. You don't only measure one because they can have a variation in there. So it looks like about 4.5 to 5 boxes. So about 0.18 to 0.20. Your QRS is some are a little bit wider than other. This one looks about 2. This one looks about 4 box, like 1 box. So it's about 0.04 actually, even maybe 0.06. So it's about 0.04 to 0.08. Your QT interval, let's measure your QTs. From the beginning of your QRS to where your T wave comes down, and again, this is a slower heart rate, so your QTs are going to be longer, and I believe it came to 0.56. So your interpretation of this rhythm is it's sinus, and the heart rate is less than 60, so you're going to call this a sinus Brady. The other thing you might want to note, if you did your isoelectric line, your STs are a little depressed. I'm not very straight with my isoelectric line, but that might be significant, so you might want to get a 12 lead EKG and check your patient. So we have a scenario for this patient. The rhythm belongs to a 72-year-old female who was brought to the ED after having been found barely responsive at home. She is arousable, but complains of feeling very dizzy. Her blood pressure is 68 systolic by Doppler. So that's, you can't even get a good blood pressure normally, so that's pretty low. So we're going to say she's symptomatic bradycardia. So what would we do? Again, you vomit, get your vital signs. You get your oxygen level, see if her saturations are okay. Is she breathing okay? On a monitor, you have her on the monitor. You might want to get a 12 lead EKG. Make sure she has IV access. And with that IV, you're going to give her atropine, 0.5 milligrams. That's your treatment. And you may also want to consider putting a transcutaneous pacemaker on her. And if those do or don't work, you can also consider putting a dopamine drip 2 to 20 mics per kilogram a minute or epinephrine 2 to 10 mics per minute. In this strip, 6.38, the rhythm is considered regular. You have a heart rate of 106. If you did a 6-second, okay, you're going to check right within. Now, this one's a really hard one. Is it really just off the 6 seconds? So I'm not going to actually count that first one. So you have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. So your heart rate's about 110. Multiply that by 10. But more exact, it's 106. So basically, it's over 100. So your heart rate's 106 exactly. You have P waves. They are all upright. They all look the same. So we know that they came from the SA node, with them being rounded and upright. So we can do a PR interval. So let's check our PR intervals. And it looks like, again, you're going to check a couple of them. just so you can see where we're measuring from. And your PRI looks about 4, maybe 4.5 boxes, so 0.16 to 0.18. Your QRS interval, again, you're going to measure from the beginning of the QRS to where it kind of comes down. That looks like about 2.5 boxes. This one almost looks like 2 boxes. And so I would say it's about 0.06 to 0.08. It's a normal QRS. Your QT interval. Let's get rid of the other stuff underneath. So your QT, because you start from the beginning of your QRS and you end, so your QT is looking like about 7, maybe 7.5 boxes, so 0.32 to 0.36. And your interpretation of this rhythm, it's originated from this SA node, so it's sinus. The heart rate is greater than 100, so it's a tachycardia, so this is sinus tachycardia. Again, what do you do for sinus tachycardia? Find out what the cause is, or why they're in sinus tachycardia. So you're going to assess your patient and check their vital signs and make sure that they're not dehydrated, they're not having pain, they're not anxious, they're not having SIRS or sepsis, and they don't have a fever. So those are things you, again, sinus tachycardia, find out why their heart rate's up. What's the compensatory mechanism that's triggered? In 6.36, in this rhythm, the rhythm is regular. The rate is 41, and if you did your 6 seconds strips, you would not count the first one. And you have 4 complexes. You have P waves before every QRS, so we are going to call that sinus. And with that P waves and R waves, we can measure our PR interval. All right, so again, before the P, before the QRS, it looks like some of them are about 4.5 to 5 boxes. Okay, measuring your PR intervals. Your QRS, so your measurement is about maybe 2 boxes here. Some of them are a little bit less. Maybe the first one almost looks like just 1 box. So it's about 0.04 to 0.08, all within normals. And your QT interval, start from the beginning of and it looks pretty long, but again, this is a bradycardia, so therefore it's going to be long. So you count how many boxes, and it comes to be 0.56. So 0.56 is the QT interval. Your rhythm interpretation is a sinus brady, and note that there is some ST depression. So we always want to kind of look at that. So if this has a scenario on it, so if this rhythm belongs to a 72-year-old female who was brought to the ED after having been found barely responsive at home, she's arousable, and she's feeling dizzy. She has a low blood pressure of 68 Doppler. So again, you would treat this patient, the Brady algorithm, vomit, check their oxygen, and administer atropine 0.5 IV. You can repeat that every 3 to 5 minutes up to a total of 3 milligrams. And you may want to consider transcutaneous pacing, and if needed, a dopamine 2 to 20 mics per kilogram a minute, or epinephrine 2 to 10 mics per minute. In 6.42, this R to R is actually irregular, so we're going to count how many R waves within the 6 seconds. So your 6 second strips are here, so all of these complexes. So you have 1, 2, 3, 4, 5, 6, so your heart rate is about 60. You have P waves, they are all upright, they all look the same, they're coming from the SA node, so we're going to call that sinus. Your PR interval, you're going to measure beginning of the P, the beginning of the QRS, and count how many boxes there. It looks like about 3 to 4 boxes, so 0.14 to 0.16. Your QRS, you have an S wave, so don't forget to add that, so it looks like about 2 boxes there. This S wave is a little bit smaller, so it looks like a 1.5 boxes. So your QRS is 0.06 to 0.08. Your QT interval, let me just get rid of some of this stuff. All right, so your QT looks pretty long. It almost, because there's a U wave that's hanging on it. But, okay, that's actually where your T wave comes to an end right here. And that right on the end of it is a U wave. So your actual looks like about, maybe if you were to go to the end of the U wave, it looks like about 0.44, 0.46. So we'll try to have to go in that end. Don't worry too much about that, but your QT interval is about 0.44. So your interpretation of this rhythm is it's coming from the SA node, so we're going to call it sinus. The heart rate's in the 60s, but we're going to call this a sinus arrhythmia. And it does have a U wave that kind of attaches at the end of the T. So you have sinus arrhythmia with a U wave. And again, you would check your electrolytes to make sure that they weren't hypokalemia, or if this was something new, or some of the medications that they're on, or hypomagnesemia. Those are other things that can cause that. And the last strip, 6.89, this rhythm is regular. It is got again, you have this, they look a little different, which is okay. This one doesn't have a big R wave, but they are sinus. So your R to R's is regular, and it has, heart rate is about 54. If you were to count how many R waves, you have about 6 complexes, or you're going to call that 60-ish, but we're going to be more exact, and it's 54 is the heart rate. You have P waves, they are sinus, they're all upright, they're kind of peaky, so you'd wonder if this patient has some COPD, because that can cause that look of those peaky P waves. It's still coming from the SA node, but it might have some right atrial enlargement. That's why they look like that. So we have P waves, we have R waves, so we're going to measure our PR intervals. So you measure from the beginning of the P to the beginning of the QRS, beginning of the P to the beginning of the QRS, and it looks like some of them are about 5 boxes, so maybe a little less, so about 0.18 to 0.20. Your QRS, now they kind of vary, so I'm looking at, I'm going to show you how to measure some of the ones that have the R wave. So you measure from the beginning of the R wave, to the S wave. So it actually would be right there. So that's about 2 boxes. Some of them are a little bit smaller, maybe 1.5 box. This one is even smaller, I think. Again, you have to kind of bring it down and go across. So that's about 1.5 to 2 boxes, so it would be 0.06 to 0.08. Your QT interval. Now the challenge is that you have T wave inversion, so you're going to measure from the beginning of your QRS to where the T wave comes back up to the isoelectric line. I'm going to try to get another one from the beginning to where it comes up. So you're going to measure your QT interval, and it looks like about 10 boxes, maybe 10 to 11 boxes. So your interpretation of this rhythm is sinus, because your S no, and the heart rate is less than 60, it's 54, so we're going to call this a sinus Brady. The other thing to take a note of is that it has some elevated STs. So if I'm going to draw my isoelectric line, you can see that my STs are elevated, and that is significant. So therefore you would, and the T waves are inverted, which also shows signs. So this patient's probably having a STEMI. So what are we going to do? we're going to get a 12-lead EKG on that patient for sure and assess the patient and monitor. You're going to vomit, you're going to get vital signs, you're going to possibly give them aspirin to chew on to 165 to 325. And again, 12-lead EKG is very important to get that done as soon as possible. And that concludes this content on your sinus review.